More than 30 million men struggle with erectile dysfunction, and for them, the stress and anxiety can lead to relationship problems. Springview Medical Clinic has a non-invasive solution to treating ED, and this morning, we're exploring another important piece of that puzzle, the role of a partner in this situation. Joining us now is Katie Harwood of Springview Medical Clinic. Welcome.
Hello, how are you doing today?
I am doing good. Thank you so much for joining us this morning. I'm excited to talk about this because a lot of times we think about the patient, right, which is very important, but hello, there's a partner involved as well. And first, I want to ask you this, Katie, like, how does the partner bring up the conversation that their partner could be suffering from erectile dysfunction? What are your tips on how to really start the conversation? Because it can be embarrassing.
Correct. So first and foremost, I just want everybody to know that this is a very prominent thing. A lot of men deal with this issue. We are seeing 50% of men over 50 are dealing with this, and I think the numbers are even higher. This is such a hush-hush topic, but we need to bring the communication to the table. We need to have that open dialogue. And when two people can speak together and talk about this openly, we can create a better relationship. We know that intimacy is a super glue to relationships. So when we get intimacy back on track, the relationship follows.
It's so true, and yeah, like I mentioned at the top, 30 million men suffer from erectile dysfunction, and you all say you have a solution that can really help. It's non-invasive. Let's talk about it. How does you all's procedure work?
Yes, so here at Springview Medical Clinic, we have a breakthrough treatment called acoustic wave therapy, which treats ED, no pain, no injections, no downtime. So what it is a small device that is placed on the skin, and it produces gentle pressure waves to those blood vessels, opening those blood vessels back up, providing for greater blood flow when and where a guy needs it the most. So this is a blood flow issue, and we are actually treating the root cause of ED for most men.
And it's impressive to hear that because a lot of times we think of the pills, right, the possible surgery, but this is non-invasive. So if somebody chooses to go this route, is there anything that their partner can do or the patient? What can they do to help prepare for this? Is there anything we need to do to prepare for this?
Right, so this is such an easy thing. You just come in, talk to a doctor, get the assessment, have a blood flow ultrasound, and see if you have a lack of blood flow, and that is what's causing the ED. And if it is, partners come in. We do see better results when the two significant others come in together and get this treated together, because I think it's open communication. The people feel more comfortable talking about it and thus getting more and better treatment for it. So we do recommend that people do this together in relationships.
Good to know that partners are actually allowed to attend the treatments. And once they go through the treatments, how much do they have to come in order to see the results? Is it a one-time thing, multiple treatments? What can you tell us?
Great question. So a lot of the men actually see it after their first treatment, and the treatments are only 15 minutes long. Like I said, there's no downtime. So you can literally come in on your lunch break, have the treatment, and go back to your daily life right after. So some men see it that night, and some after the course of 2 or 3 treatments. It just depends on certain men and their health and all the different things that we take into account when having the treatments conducted.
Yeah, and Katie, once the treatments are conducted and they're successful, what sort of changes can the partner expect in their relationship besides the obvious, right?
Right. Yeah. So we see that when intimacy is back in the relationships flourish. People can communicate more. And we just know that when you have that intimacy, the relationship is back on track and other things follow. So you can communicate more, which we all know is such a big building block to relationships.
And like I mentioned the last time you all were on, you all believe in the treatment so much that you actually have a special offer that you want to offer all of our viewers watching right now. What is the offer?
Yes, so gentlemen, call today, or your significant other can call as well. We will offer a free assessment, a free exam. We will even give you a free blood flow ultrasound and a special gift that will provide rapid results in the bedroom for you and your significant other, but you need to not put this off and call today.
So true, and it's worth a lot of money, everybody, and you are getting it for free. Like she said, you have to call now. I'm curious, as a female, for the females that you've seen who have gone, with their partner to this treatment, what has been their reaction from the partner side?
So that's my favorite side, right? So this is such a beautiful question. I see women that come up to me and directly tell me how much this has impacted their relationship, how they feel seen again, how they know that it wasn't them and that it was just something that's treatable and it's just a medical diagnosis. So that takes a lot of pressure off the woman. So those are the best things that I hear, is that women know that it's not them and know that they can get this back into their relationship.
Partners, you hear that? They are trying to help out the relationship. Okay, Katie, I want to thank you so much for joining us this morning. And I remind everybody one more time that there is a special offer going on right now. You can get a free consultation if you call right now. It'll also include a free exam, blood flow ultrasound, and a special gift as well. That's a value of over $600, and you are getting it for free. But you have to call now. The number is 504-313-4000. You can also find them online at springviewmedicalclinic.com.